مرحبا بكم مرة أخرى أحبتي المشاهدين في برنامج لقاء اليوم تحت عنوان أنت تسأل والطبيب يجيب. مثل ما تعرفون أحبتي المشاهدين، بالأشهر الماضية أو الحلقات الماضية اتفقنا أن يكون هذا الموضوع موضوع اللقاح، أنت تسأل والطبيب يجيب، على سلسلة حلقات. كل شهر تقريبا راح يكون لنا محاضرة لحضراتكم. إذا تشاهدونا من البيت أو من أي مكان آخر راح نكون حاليا لايف، فتقدرون تكتبون تعليقاتكم أو أي سؤال أي استفسار، الدكتورة موجودة هنا حتى تجاوب أسئلتكم. أو بالنسبة للحضور الموجودين هنا طبعا أرحب بكم كلكم، أهلا وسهلا حضوركم. أي واحد عنده سؤال يكفي إنه يرفع إيده، وأكيد راح يكون عندنا أكثر من مترجم يترجمون بأكثر من لغة اليوم. بالنسبة للمحاضرة راح تقدمها دكتورة تمارة مانسي من عيادة سيدرو هنا بالكاهون. قبل ما نبدي بالبرنامج أحب أن أقدم أجمل التهاني والتبريكات بمناسبة عيد المرأة اليوم 8 آذار. نتمنى كل مرأة بالعالم أن تكون بخير، نحترم ونقدر عطائها، محبتها، إنجازاتها، كل شيء اللي تعمله بالحياة نتمنى من الرب أن يقويها. وأكيد تحية خاصة لوالدتي والكل كل مرأة بالعالم. طبعا أحب أهني ست بسمة بعيد المرأة، وأكيد دكتورة مانسي. أحب أن أعطي مجال ست بسمة. بداية ست بسمة راح أعطي مجال أو أعطي الميكروفون لحضرتها تقدم شيء مختصر عن المحاضرة، وبعدين نعطي مجال للدكتورة تبدي بالمحاضرة.
Hi everyone. No. Let's try again. It's a National Women's Day. Yes. Hello everyone. Here you go. Thank you so much. First, I have to thank Tanya. She spoke in Arabic, so I'm going to speak in English so everybody will understand. And we have a Dari translator, and we have Arabic translator, and the doctor will speak English, and we have Spanish, but I hope you understand English. Unfortunately, we don't have a Spanish speaker today. But I promise, next time we will have one. Thank you so much for being here. You have no idea how appreciated I am to see you all here. It's amazing to have you, and a majority of the people here, they're women. It's a National Women's Day. Congratulations, and congratulations for you to be here. To listen to the presentation, to understand about COVID, and if you have questions, of course, you can ask any question you want. I don't want to say they're all women, but we have male in here also, and we have children. So congratulations to every mother, to every sister, to every daughter, and I'm very excited to see you. My name is Basma Koda. I'm a project manager at Sydro Health. Sydro Health, it is a health center that we have 50 clinics around San Diego County. But we were focused on the clinic in Cajon. So we have the largest clinic in Cajon, and of course, if you like to know where the clinic is, we can provide you with the address. I have to give the thank to the CRT, which is the Chaldean Radio TV, that we went live. You can, people, if you know people, please send them the link, because they will watch it live right now, and also watch it live, and they can ask the question live. So ask the team, they will tell you how to log in. And then your relative in Afghanistan, in Iraq, in different countries, they can watch you right now. That's one thing. And then the second thing, I really appreciate the school. Lexington Elementary School. Can we give a round of applause for the school? Woo-hoo! Yes. Thank you so much for the team of the school. They try their best for you to be here, for us to be here, and also for the doctor to be here. So I'm very thankful for the school to give us this opportunity to meet the relative, to meet, the relative of the students. So you are the best example for the rest of the school parents because you are here. You will be enjoying the presentation. The doctor will provide the presentation. And then, of course, we will give you opportunity to ask questions. So kudos to Lexington Elementary School. And I'm sure other schools, they would be jealous now. So they wanted to, for us to go there. Anyway, I don't want to make it long because we're already late. So, I'm going to give the opportunity. I will introduce Dr. Mانسي. Dr. Mانسy is one of the Sydro health doctor. She is very familiar about COVID and Corona. She's very expert and she can give you any questions you ask. One thing I wanted to tell you, just like I said in my commercial at the CRT, that if you think the coronavirus is gone, please think it twice. Coronavirus is within us. So the vaccination, it is important. Why? Because we have to save life. Not only our life, our children's life, our relatives' lives, but the rest of the community. We have to live in a healthy community. So we have to know and understand the diagnosis, which the doctor, she will be explaining. And then we need to be careful that if you hear that, oh yeah, there's no more, COVID, no, it's going to be biologically with us, just like the flu, like other, viruses. So with that said, I will introduce Dr. Tmara Mánsi. Big applause for Dr. Tmara Mánsi, please. And thank you.
شكرا سيد بسمة. عفوا شكرا سيد بسمة. أكيد حاليا راح نخلي الدكتورة تمارة مانسي أخصائية طب باطني من عيادة سيدرو هيلث تقدم المحاضرة نبدي بها لأن أوريدي تأخرنا شوية فتفضلي دكتورة.
Good afternoon, everyone. Thank you for having us here. Adnan, can you put up the slides, please? So I will have a small lecture about the COVID, just to increase the awareness and education about the disease itself, the infection, and how can we do as our part to end this pandemic, to try to limit it. Next, please. I'm one of the internal medicine physicians at Sydro, as they told you. We have multiple services in our clinic, including medical, dental, and behavioral health. We also have several other specialties. We provide education also in nutrition, in social services, and also laboratory. Next, please. We have multiple locations, as Basma just introduced you to. We are located in El Cajon, the one next to Chase and El Cajon Boulevard, just before the Freeway 8. Next, please. So we're going to talk about COVID, as I said. Next. So this is the data collected until March 2nd, 2022. We till this date, we have about 737,000 cases that's recorded in San Diego County. There's about 5,000 deaths, and we have 3,800 cases outbreak. So outbreak is the cases that people who received the vaccine, but yet had infection with the virus. So we call them outbreak. So we see from all the 737,000, there is only about 4,000 who received the vaccine, but then got the virus. So the vaccine really effective and helpful in preventing the infection. Next. So some people would think that coronavirus, the virus itself, does not cause really bad infection in children. But actually, some children could get really sick from it. Some of them may eventually have complications, need to go to the hospital, and a lot of them could die. So part of us need to protect our kids because they get into contact with other kids in the hospitals, in the schools, with our relatives in the parking areas. So vaccination will help reduce the risk for our kids to get infection, and that will help also our community to reduce the spread of the disease. Some kids, they do have also illnesses like obesity, diabetes. Not all of them are very healthy. In addition, most of them, when they get the infection, they are asymptomatic. It means they don't show symptoms. And they spread it to our families, to our relatives, elderly people who are really sick, and that will cause more cases. Next, please. So according to CDC, about 28 million children between the age of 5 and 11 are there in the United States. And they recorded about 2 million cases of COVID-19 in this age group. So it does really infect children. That's what I want you to all know. And there was also about 8,300 cases of kids that were hospitalized until mid-October 2021. These are not really updated data, it's until October. So we see that COVID actually was recorded as one of the top 10 causes of death in the United States, in addition to other causes of death. So it is serious infection. Next, please. Most of you have been now familiar with most of the symptoms that COVID-19 causes, and I'll just go over it very quickly. Symptoms could range from mild to severe, starting 2 to 14 days after exposure. They are ranging between fevers, chills, cough, headache, muscle or body aches, runny nose, congestion, sore throat, any shortness of a breath. Could be loss of a taste or smell, fatigue, nausea and vomiting, and diarrhea. Next, please. So for us as parents, we need to know when should I take my child to the emergency, when is like the awareness that there is severe symptoms. So when we see that they have a trouble breathing, or they have persistent pain or pressure in the chest, that does not apply only to kids, everybody, adults and kids. If they develop new confusion, if they are unable to be awakened or stay awake, if their skin turn pale, gray, or blue, the lips or nails also, and when to seek medical. Just a second. Adnan, can you go back? Yeah, next one. Those symptoms, when you see them, you have to call 911 and take your child or any adult that is sick to the emergency to be evaluated. Next. So we need to know also the spread of disease, the transmission, usually through air droplets. While we talk, we cough, sneeze, the person who is infected could infect multiple people at the same time because they breathe that air and breathe the droplets in. Or those droplets could drop on the surfaces and we come and touch those surfaces and we touch our eyes, mouth, nose, and that's how we get the infection without our knowledge. Next, please. So there were, since the start of the COVID pandemic in the past 2 years, about 2 years, we did have multiple variants that appeared. At some point, until about mid-December 2021, we did have Delta variant that was mostly, recognized at that time. But since mid-December till this time, till March, we do see a lot of cases of Omicron. And actually, Omicron began to dominate all the variants. Now about it's 100% of cases that are related to Omicron. So it is more faster spread and causes milder illness, but it causes a lot of people to be sick at the same time. And that may lead to increased hospitalization because a lot of people they might have other chronic condition and that they need to go to the hospitals for evaluation. Next. So what is our part as community members to decrease the rate of transmission of the disease and decrease the cases of COVID? We have actually 3 ways. One of them is the vaccines and the booster. The second one is the masks. And then we have the testing. Next. I'm going to talk about the vaccines, the first element to help us fight COVID-19 infection. Next. So currently, we do have the 3 authorized vaccines for the COVID. We have Moderna, Pfizer, and J&J, Johnson & Johnson. For Moderna and Pfizer, both of them are made of the mRNA of the virus, the nucleic material of the virus, and it's given in 2 shots, okay? It depends on which one you're gonna receive, Pfizer or Moderna. You may have 3 weeks or 4 weeks apart in between. And both of them can be given as an injection into the muscle in the upper arm. For Johnson & Johnson, it's made of the viral protein part, and it's usually 1 shot. We are talking about the initial series. And then it's also an injection in the arm. Moderna and Johnson & Johnson are recommended for people who are 18 years or older. For Pfizer, actually, we are giving it to kids age 5 and up. So it's given to both adults and kids. Next. So the kids dose is different than the adult dose for the vaccine. I'm talking about Pfizer. It is usually smaller dose than the adult, 1/3 of a dose, administered with a smaller needle, and the dose should be adjusted based on the child age. It's also given in 2 doses, separated by about 3 weeks, up to 8 weeks in between them, and is an injection in the upper arm. This is starting from age 5 and up. Next. Next, please. So COVID-19 vaccine is found to be very safe to be given to our kids. Very few serious side effects that were recorded by the researchers. And they found out only very few kids that got really sick from the vaccine compared to the kids that are getting sick from the virus itself and ending up having complications and going to the hospitals. So the researchers found about 90% of the cases that were vaccinated, they were effective against the COVID-19 in preventing severe illness. Next. The most common side effects from the vaccine, COVID-19 vaccine and any other vaccine actually, it's either localized to the area that we give the injection in, as a pain or soreness in the muscle. It could be some swelling, redness in the area that you got the injection in. Or it could be generalized symptoms of maybe chills, feeling tired, some headaches. All of those symptoms usually last about 1 or 2 days, and it should go away. Even you can take some Tylenol. You can give your children some Tylenol after, the first 2 days after taking the vaccine, and it will go away. Next. So because COVID-19 mostly causes mild symptoms in kids, as adults, we think it's not causing the infection in them, but actually they are an important part in the community. They are getting the infection and spreading it to other people without our knowledge because they're not showing much symptoms. Next. Next, please. I think this is a repeat. So adults and children are the same. Adults will have chronic conditions. They are more prone to have complications from the infection itself. Kids, some of them also have complications or chronic conditions that if they get the infection, they get seriously ill. And they might end up having, going to the hospital. But the most of them are very okay to receive the vaccine. the kids. They don't show much symptoms. They don't have any problems with the vaccine itself. The only the only kids who cannot get the vaccine who are truly allergic to one of the components of the vaccine itself. So if they have any problem in the past receiving any vaccine in their life, not the COVID, I'm talking about other vaccines in the kids, when they go to their pediatrician and if they had any problem, they should talk to their pediatrician if they have any allergy to any components, so they would compare with the COVID-19 itself. Next. So we do have, as I talked about, the first initial doses, that's the initial series. Once we receive 2 doses of the Pfizer or 2 doses of the Moderna and 1 dose of the Johnson, we completed the initial series. After a few months, the researchers found that the antibody level is actually going down and is not much protective as it was in the beginning. So they recommended giving a booster dose, which is given about 5 months after the second dose from Pfizer and Moderna and 2 months after J&J vaccine. For the Pfizer, because we're giving it to kids age 5 and up, the booster dose is only approved ages 12 and up, not age 5. So ages 5 to 11, they only receive 2 doses of the Pfizer, the initial primary series. And from 12 and up, they can receive the booster dose. Next. Next. So this is also the data collected in San Diego County. So if anybody has any question right now, am I speaking too fast for you guys? Okay, if you don't have any question, or maybe you think of any question, do you have any question, Rania?
أي واحد عنده سؤال؟ حضرتك عندك سؤال؟ تفضل. خلي أجيب الميكروفون لأنه
الكمامات راح يشيلوها 11 بالشهر، وهذا الشيء صحيح أو لا؟
So الكمامات راح تنشال. أحكي إنجليزي لو عربيات؟ Okay, so yeah, so she asked me about the mask. They're going to be lifted. They will lift the requirement for mask on March 11. Is that something good or correct for their kids? Actually, it is. They're taking the requirement, but they are still strongly recommending the vaccine in the class. So any place there is a lot of kids in it, they are indoor, so I think you should continue making your kids wearing the mask, okay? It's still strongly recommended. They're not lifting it. Like, they're not saying you have to bring your child without a mask, okay? But because the cases got a little less and most of the people around us got the virus and got infected, they're thinking maybe there is some immunity, there is some less rules about the masking, but you still have to mask indoors. It's strongly recommended. Does that answer it?
أي واحد عنده سؤال؟ Any questions for Dr. Mانسي? فأي واحد عنده سؤال بس ارفعوا ايدكم وتقدرون اصلا تسألون الدكتورة أو anyone have question just feel free to ask please. وشيء آخر اللي بس أذكر المشاهدين اللي يتابعونا طبعا من بيوتهم أو من أي مكان آخر، أي سؤال عندكم يا ريت تكتبوه بتعليق، لأن أنا حاليا يعني مسؤولة على صفحة الفيسبوك دا أشوف الأسماء أو التعليقات. إذا عندكم أي سؤال تكتبوه بتعليق وإحنا راح نوصله للدكتورة. تفضلي دكتورة.
عدنان next please. So this is the data collected from San Diego County. It shows us in the past 3 months, like the number of the cases of the COVID, in people who are not vaccinated, who did not receive any vaccine at all, compared to the fully vaccinated, which means they received 2 doses, and then compared to the people who received a booster in addition to the 2 doses. So we see it's about 45% affecting the people who are not vaccinated. And for the fully vaccinated, we see the cases actually 41%. It's actually got higher than before. That's because they only received 2 doses, the immunity went down, the level of antibodies, and they didn't take the booster dose, so they got the infection. For the people who got the booster dose, we only see 12% of them got infected with the COVID. Regarding the hospitalization rate, it means the people who got really severely sick because of the vaccine, because of the virus, and they had to be hospitalized. About 56% of them, they are unvaccinated at all. And about 32% of the people who are hospitalized because of the COVID, they were only, fully vaccinated. It means they received only 2 doses. And from the people who got booster in addition to the 2 doses, 11% were hospitalized. Now, if you look at the death rate, you will see the death rate is worse in the people who are not vaccinated. It's about 64% of all cases that ended up dying because of the COVID-19. They were not vaccinated at all. And 33% they received 2 doses, and very low percent, 2.3%, who are vaccinated and got the booster. All I want to show you from that is COVID-19 helps with reducing severity, helps reduce the hospitalization and the death from COVID-19. So the vaccine is effective in helping us getting less severe infection. Next. So here it says that maybe we think if we get the vaccine, we might not get any virus at all. No, we still might get the virus, the infection. So be aware whenever you get the infection, you have to do quarantine. And the first thing we do actually is vaccinate our families, vaccinate our kids to help spread. And that will help also reduce the severity. Next, please. So the immunity actually starts after 2 weeks from completing the first dose of the vaccine. So if you get the 2-dose series, it should be between them 3 weeks and 4 weeks apart. After 2 weeks, your body will start making antibodies and help protect you. Next. We talked about the breakthrough cases, which means those are the people who are vaccinated, but yet got infected with the COVID. Next. Next, please. That's a repeat. So the first part of our discussion today was about vaccine. We said we have the 3 important elements to help reduce the COVID-19 infection in the community. First one was the vaccination. Next one is the mask. Next. The mask, it should be people who are not wearing mask, of course, are not protected at all, especially if we are indoor, where there's a lot of people, gathered together, whether at home or maybe in the classes and in the, any places that there's family gathering, or in schools, in offices, at work. It's better to wear any kind of face covering to help reduce the infection. We do have the cloth masks. It's the least protective, but it's better than nothing. Then it comes the surgical masks, which most of us are wearing. These are the disposable ones, similar to this that I'm using. And then we have the high filtration masks, the 4th one. And this is only used by healthcare professionals in hospitals and clinics. Next, please.
عفوا دكتورة، هناك سؤال من رائد يسأل: أين يمكنني إجراء فحص كورونا؟ وكم يحتاج من وقت مع تزويدي بتقرير طبي مطبوع لحاجتي الماسة له؟ يعني يريد يسوي فحص والنتيجة يريدها على شكل تقرير. هذا السؤال. أكو سؤال آخر.
Sure. So she asked about, somebody is asking where they can get the COVID-19 test to be done and how fast he can get the report ready if he needs it for his work or like an excuse for somebody asking him. COVID-19 testing is available in most county sites, a lot of sites available. We can just, Google it, see what are the free available areas, or some of them take either medical insurance, they can pay for it. There is also rapid testing. I'm going to talk about it more later after the mask. I do have also a section about testing. So we have rapid tests that can be done at home. You can get it from any pharmacy, and there is also a website that the government is, providing those tests free at, for families, 4 tests for each family. I'll talk about it more now.
Thank you دكتورة. لميا تسأل لماذا لا يوالم كل من هذه اللقاحات لشخص لديه حساسية بالدم؟
So she's asking about that those vaccines, they might not be suitable for people who have allergy. So allergies are multiple types. It's not one kind of allergy. They should exactly know the person who has allergy. They should know what kind. What is the substance that's in their blood causing them to have the allergy? And it's better to answer this question is by your primary care or your physician, who could run the test for you and see if those elements that are present in the blood, the same as the substances used to make the vaccine, then you should not get the vaccine. But if it's different, the vaccine should be safe, is not the one causing the allergic reaction. بالنسبة لل you want me to answer? بالعربي لأنه sounds good. So الناس اللي عندها حساسية هي عدة أنواع. الحساسية مو نوع واحد، أكو هواية مواد بجسمنا بالدم مالتنا ممكن تسبب حساسية. فالشخص الأفضل اللي عنده حساسية الأفضل إنه يسأل الطبيب مالته ويسوي له فحص خاص يعرف شنو نوع الحساسية ماله، من شنو يعني المادة اللي تسبب له هاي المشكلة. إذا هاي المادة موجودة بالفاكسين نفسه باللقاح اللي هسه صنعوه، يقدر يحكي ويا الدكتور ماله ويشوفون. يقدر الدكتور يعفيه عن أخذ اللقاح إذا بالفعل عنده حساسية من واحد من المواد مكونات اللقاح. Yes.
جواب التعليق الرائد أين يمكن إجراء فحص كورونا ويحتاج لوقت تزويد في تقرير؟
نعم. Yeah. So she's asking me about the report. I did not answer that. So the report depends on the type of test. If it's PCR, it's going to take about 1 to 3 days before I will do it in Arabic. 1 to 4 days before the result is available. And depending on the place they give you, they can give you a report about the results. Rapid test will be ready in like maybe 15 to 30 minutes, and you can bring the test with you to the person who is asking you about the results. So بالنسبة للتقرير اللي يعتمد على نوع التست الاختبار اللي نسويه. اكو البي سي ار اللي يدور على الحامض النووي مال الفيروس، واكو التحليل السريع اللي يدور لنا على الانتيجين مال الفيروس. فبالنسبه للبي سي ار ياخذ له حوالي 1 إلى 4 أيام على ما تطلع النتيجه، ويقدر ياخذ التقرير من المكان اللي سوى به التحليل. اما اذا يريد يروح للعياده مالته ويطلبها من الطبيب راح يحطوا له اوردر، الطبيب يقدر يزوده بعدين من تطلع النتيجه ينطي له التقرير وياخذه وياه. No worries. Next, Adnan. So الاليمنت الثالث احنا حكينا على اللقاح وحكينا على الاقنعه، وهسه جاي عندنا دور التحاليل. مثل ما هسه قلت لكم عندنا نوعين من التحاليل الرئيسيه. الاولاني يعتمد على الحامض النووي مال الفيروس نسميه بي سي ار، ياخذ 1 إلى 3 أيام او 1 إلى 4 أيام. بالنسبه للرابد او الانتيجين تيستينج ياخذ له 15 إلى 30 دقيقه. So أنواع the types of the testing for COVID-19, it's actually we have 2 types of tests for the diagnosis, to make the diagnosis. One of them depends on the nucleic acid, the PCR testing. That takes about 1 to 4 days. It is more reliable. it can give you, an idea about the patient whether really infected or not. Rapid testing actually less reliable. It can be done any place, anywhere at home. It takes about 15 to 30 minutes. There is also serology or antibody testing. It actually identifies if your body has developed antibodies to the virus. And this is not really recommended because it's time consuming, it's very expensive, and most of the people, they don't rely on it. Even like, if you go your work, the job, they do not ask you for the antibody test. The most common one is the PCR. Next. So it shows you a diagram about the rapid test that can be done at home. Most of them, they come with instructions and it teaches you how to use the test at home and get the sample. But in order to get it very accurately, you have to follow the steps as it shows. If it tells you you have to wait 30 minutes before you read it, you wait 30 minutes. If you need to wait 15, then you have to wait 15. So for most of them, the positive test result shows 2 lines, if you see here. The negative, it shows only 1 line. Okay, this is very, let's say, available testing at home when we are not sure if we're going to a gathering or going by a plane or a travel. It's better to do the testing before you go to any place with a lot of people. And it tells you an idea about yourself or the person who is worried that he might be sick. It could give you a quick idea. If it's positive, at least they will need to quarantine. Next. So this is the website where they provide the free home testing, covidtest.gov. It gives each family 4 rapid antigen testing. It means each address you enter. And you can go to this website online from your phone, your computer, and order them. Actually, they started ordering them back in January, by the end of January, and I'm sure a lot of you got some dose of free testing at home. Next, please. So COVID-19 is, the testing is free and safe. If you would like to do PCR or rapid testing, is available around us in many multiple places. Okay, and you can ask your doctor or the clinic you follow with or any pharmacy. They will provide you with the locations where they can do the testing, or you can just Google it yourself for San Diego County. Next. Next, please. So what do we do after we getting tested? If you test positive, you need to isolate at least 5 days, okay? Depending on the place where you are at, like where you work. Every place, they have their own rules, and most of them, they follow the CDC and the CDPH guidelines. So the least amount of quarantine is the 5 days. If you still have symptoms following the 5 days, you still need to continue quarantine. Go back, please, Adnan. And if you test negative, then you go back to your normal activities, especially if you do not have symptoms. But as I said, even if you test negative and you have symptoms and you're still in doubt, it could be COVID-19, is better to isolate and get retested again in 5 days. Next, please. Now the most recent update, we've been having those monoclonal antibodies that are used for the treatment and the prevention of COVID-19. It is only available for certain type of population. They meet certain criteria when they develop the COVID-19 in the first 10 days. They should be high risk for having complications. As we talked about earlier, the people who have chronic conditions, heart disease, diabetes, asthma, people who have conditions, they are at high risk. Those are good, eligible to get the monoclonal antibodies. Now we have monoclonal antibodies used for prevention. It's only again used for certain people, those who tested, in contact with people who tested positive for the COVID-19, and they have conditions like cancer or immune suppression, like HIV. They cannot, mount an immune response after receiving the vaccine. So even though they got the vaccine, their body was unable to develop antibodies. So those we can give them the treatment, the monoclonal antibodies. Next, please. Those monoclonal antibodies are really effective. It decreases the hospitalization rate and the severity and complications by about 70% if they are given in the first 10 days. And if you feel like you have, severe symptoms, or you're very worried that you might get, complications from the COVID-19, maybe you can talk to your provider, the primary care, and they can assess whether you need those medications or not. It's only provided at certain clinics and locations. It's not available all the time.
Any questions?
هذا اللقاح هل يقضي على مناعة طبيعية؟ يعني شنو قصدي؟ مثلا هسه إذا واحد ياخذ فاكسين ويجي تعرفين طلع له غير ضار، لازم بهذا الوقت هل المناعة الطبيعية ما قامت تشتغل إلا باللقاح الثاني يطلع أو هذا؟ يعني يلعب بالمناعة الطبيعية.
Yeah, I got you. So she's asking me if taking the vaccine really mess up our immunity and our body to mount any antibody response for other infections, right? Other infections. So actually the vaccine is helping yourself, your body, to make antibodies for COVID-19, okay? And similar viruses. I'm gonna say maybe adenovirus. Some viruses share similar component. But other viruses, the vaccine definitely is not messing up with your immunity. Your body is still able to mount immune response for other viruses, other bacteria. So you can always get your own natural immunity going on still. It's not affecting it. يعني اللقاح ما يأثر على المناعة مال جسمك، بالعكس هو ينطيك مناعة. بس المناعة ده ينطيك إياها مو لكل شيء. الدنيا بيها هواية فيروسات، مو بس الكوفيد. سو انت من تاخذين اللقاح تتحصنين ضد الكوفيد اللي هو احنا الهدف مالتنا حاليا، بس هذا مو معناتها انه ما عندك مناعه ضد باقي الفيروسات.
ما يأثر على المناعه الطبيعيه؟
نو نهائيا.
ما يأثر على المناعه الطبيعيه؟
نو ما يأثر على المناعه الطبيعيه، جسمك نفسه هو موجود، خلايا كريات الدم البيض اكو نوع من عندها نسميه البي سيل، هي مسؤوله انه اي جسم غريب يدخل لجسمك هاي راح تبدي تسوي تفاعل وياه وتطلع اجسام مضاده ضد هذاك الجسم. اذا كان بكتيريا، فيروس، حسب. So ما لها علاقه ب other infections or other immunity.
Any other question?
How about the long side effect of the vaccine, like Pfizer and Moderna? They say they have inflammation. Some cases like they do have inflammation, and Johnson & Johnson, I think the blood clotting. This is not some people they don't want to take this.
True. So there were very few cases recorded in both Moderna, Pfizer, and Johnson & Johnson with some serious complications, but they were very few cases. I don't have the numbers on top of my head. I know from about 8 million kids, only 100 developed severe side effects relating to myocarditis. Myocarditis is an infection of the heart muscle. It's an inflammation actually of the heart muscle that happened after getting the vaccine. But it all resolved right away with medications in the next coming couple of days. The vaccine was found to be really safe for other people. The majority of them, they didn't have any side effects. For Johnson & Johnson, they did have complications also about, I think 7 women reported from, it was a really big number. So very few people got that. It's a type of a platelet disorder that can cause a clotting. And also Johnson & Johnson was found to have Guillain-Barré syndrome, which is also a type of a neurological disorder affecting the nerve ending. So there were more side effects with Johnson & Johnson than Pfizer and Moderna, but most of them are, I could tell you more than 90%, they were very safe. They didn't develop any side effects. Go ahead.
أفضل لقاح للأطفال من عمر 5 ل 12 أو 15 شنو هو؟
فقط الفايزر. Only the Pfizer approved for kids. We don't have choices for them. For kids, it's only Pfizer. For adults 18 and up, you can choose. You want Pfizer, Moderna, or J&J.
زين هو يكون إجباري للأطفال إجباري هو؟
Till this moment, nothing is إجباري. ماكو. You're not forced to get the vaccine. It's all, optional. Okay, but it's highly recommended. It's highly recommended. It's not إجباري.
دكتورة، السؤال من لمياء تقول الأجهزة اللي وزعوها بالمدارس النتيجة مالتها ما تعترف بها العيادات الصحية.
الرابد تيست يعني؟ أعتقد قصدها على الرابد تيست. يعني مثل ما قلنا الرابد تيستينج is not very reliable. يعني إذا أنا أعرف الشخص عنده احتكاك بواحد قال لي يعني مثلا ابن عمي قال لي عندي كورونا قبل 3 أيام I tested positive وأجي هسه ابني عنده symptoms وأقيسه بهذا التست ويطلع negative, that doesn't mean it's correct. I agree. The best one is to do أحسن واحد هو PCR. الPCR testing راح يعطينا فكرة أفضل عن المرض إذا بالفعل الشخص عنده أو ما عنده. بس كلها هاي التستات همين يعني خلينا نسميها false negative همين تنطينا مرات نتائج غير reliable 100%.
ما هو الحل لشخص لا يقدر أن يأخذ اللقاح ولديه سفر؟
هسه نجي إنه السبب ليش ما يقدر إنه يأخذ اللقاح. لازم نعرف شنو السبب، إذا هو مريض حالياً أو إنه عنده ألرجي مثل ما قلنا، لأن فقط الأشخاص اللي عندهم ترو ألرجي لواحد من المكونات مال اللقاح ذولا ما يقدرون ياخذوا. أما إذا هم مثلاً ما يقدرون مترددين، الشيء اللي نقدر نسويه مثل ما قلنا نلبس الأقنعة، نحاول نبتعد عن الاختلاط عن الآخرين، ونفس الوقت إذا عندنا أعراض أي شخص عنده أعراض أو مريض يقول للآخرين حتى لا يختلط بينا. هذا الشيء الوحيد اللي نقدر نسويه.
نرجع للمحاضرة دكتورة وبعدين نرجع مرة أخرى لفقرة الأسئلة.
I'm almost done anyway. سؤال؟ Oh, you want me to say it in English? Yeah. So your question.
Okay.
So she asked me about what happens to what they can do, the people who cannot receive the vaccine for any reason and they have travel. So it's recommended to take the vaccine as much as possible. If you can't take the vaccine, you can still travel with the precautions. It means putting the mask on, maintaining distances, and do the testing also. You can do the test before the travel to see if you are negative, you're safe to go. And we do not want to forget the isolation and quarantine if anybody feeling sick or having symptoms. Okay. Next, Adnan. I'm almost done with my lecture. Next please, yeah. So هاي كل هالأشياء حكيناها، نعقم، نخلي try to maintain distances, use the face mask when possible, when you are indoors, stay sick when you have symptoms or somebody you know that you came into contact with. All of these are still important in addition to the vaccine. We're not going to disregard those. Next please. And as we said, COVID-19 vaccine is available a lot of the places. أغلبية الصيدليات, most of the pharmacies, they provide the vaccine whether by appointment or walk-in. And if you are really interested in getting it under supervision, you can contact your physician, primary care, and they can schedule you one. A lot of clinics available and they have the COVID vaccine. Our clinic, Siedrao, also provide the vaccination if you guys are interested, but it's mostly by appointment. And we can see here CVS, Walgreens, Rite Aid, Ross, all pharmacies provided. Next, please. Yeah.
Hello again, it's me. I know the school have a lot of gifts for you. And as you see, there's 1, 2, 3, 4, this is appreciation from the school for you coming. So what we have here is your raffle ticket. So, do all of you have a piece of the raffle ticket? Please let me know if you don't have one, so we can give you one. Now, Nergis, she's gonna pull one of the numbers in order for you to receive a gift.
كلكم عندكم هاي الكارتات الصغيرة مال رافل تيكت، اللي ما عنده خليه بس ياخذ من ست نرجس كويس.
Okay. So we're gonna do it really quick in order for the doctor to complete the finish.
And good luck.
And good luck. Yes.
Thank you so much.
Okay, you wanna read it?
Okay, it's the ticket number 6399741. 6399741. Six three 99745.
Yay! You got it wrong. Now, just which one you're gonna give? Okay.
6399743.
Another number.
6399743. 743.
Another number, doctor.
I don't have the basket. Okay. Nargis. That's this number. Okay.
No.
Oh no, like she had this.
She has the
She
gift.
thinks she got it.
Oh, this one. Maybe
yeah.
this one. The first one.
So it's like
The first one. The first one.
none of them is 25.
No, it's not 25. Okay.
Yeah.
Not yet.
So till now I got the ending 41, 43, 45. Next number is 6399722. So ending 22.
722.
We have another number 6399731. So 31 ending.
All right. Thank you. Thank you for coming, guys.
There's one more. One more.
Oh.
When?
It's right there underneath the computer.
Oh.
So ending 37. 6399737.
737.
737.
All
There.
right.
Over there.
Thank you.
Anyone?
We have that king.
Oh, okay.
All right.
Congratulations.
So much. Thank you. Congratulations to
Thank you for
everyone. This
coming.
finished.
Thank you, Doctora.
Thank you.
شكرا جزيلا اعزائي اولياء الامور الحضور. شكرا لكم بحضوركم لهذا ورشه العمل. Thank you very much. I really appreciate you coming to this workshop. I hope you get benefit from it, and great thankful for the doctor and also for the radio, Cajon radio, and also for Miss Isma and the other crew. I really appreciate everybody. I didn't know the names. Dennis, Mr. Adil, and the cameraman. Thank you very much. Congratulations, and see you at our next workshops. Bye-bye.
Thank you everyone for listening. I hope it wasn't boring.
No, I think they were very interesting.
Just to please give us a few minutes in order for you to take your survey أو الاستبيان اللي هو ضروري. So just take the survey. Let us know how you benefited from the presentation. Thank you so much, and thank you everyone.
أحبتي المشاهدين، إلى هنا وصلنا إلى ختام حلقتنا اليوم من برنامج لقاء اليوم تحت عنوان أنت تسأل والطبيب يجيب. أحب أشكر ست بسمة، أكيد سيدرو هيلث، دكتور تمارة مانسي. أحب أشكر الحضور، أحب أشكر اللي كتبوا تعليقات واللي كانوا يتابعونا طبعا من خلال البث المباشر للفيسبوك لCRT. أشكر أستاذ عدنان اللي هو بالاستوديو بغرفة الكنترول، وأشكر أستاذ عدنان كندو بالكاميرا اللي موجودة هنا بمدرسة ليكسينغتون. شكرا لكل اللي شاركوا في تقديم هذه الحلقة. انتظرونا في الحلقة المقبلة.